over the funding gap in the social health authorities, saying many of them are unable to complete their treatment due to financial constraints, which SHA has not adequately addressed. Elizabeth Atino now reports.
Cancer is the third leading cause of death in Kenya, with over 45,000 new cases recorded annually. A situation likely to get worse if the concerns raised by cancer patients is anything to go by. The patients have taken issues with the Social Health Authority, saying the 550,000 Kenya shillings allocated for the oncology package is not enough.
The cost per cancer case stands at 3 million Kenya shillings per person.
And although the package is designed to cover for chemotherapy, radiotherapy, specialized procedures, diagnostic services, and hormonal therapy, there exists a huge funding and communication gap, with many cancer patients forced to abandon their treatment.
However, these benefits remain only on paper. And currently, cancer patients pay more money out of their pockets, regardless of their social health insurance fund.
The patients have also raised concerns that some cancer patients have been coerced into registering for Lipa Mdogo Mdogo, urging the government to reconsider its move on the SHA annual payment, as many Kenyans cannot afford to channel their contributions on a yearly basis.
We are advocating for the patients to be allowed to pay in installments. So if they can pay monthly like we did when we had NHIF, then that would make it much better.
The Social Health Insurance Act established 3 funds, including the Social Health Insurance Fund, the Primary Healthcare Fund, and the Emergency Chronic and Critical Illness Fund. However, there exists a huge funding gap. For instance, in the 2025-2026 financial year, the Primary Healthcare Fund has been allocated 4.2 billion Kenya shillings against a resource requirement of 62 billion Kenya shillings. The Emergency Chronic and Critical Illness Fund has been allocated 2 billion Kenya shillings, yet it requires 107 billion Kenya shillings.
WHO also recommends 5% of GDP to be allocated to health. Unless this funding is scaled up and sustained, the strategy risks remaining a paper promise.
Additionally, the non-communicable diseases prevention and control expenditure is estimated to be 2.2 billion Kenya shillings in the current financial year. This amount is far below the 49.2 billion Kenya shillings required for the full implementation of the National Cancer Control Strategy.
And citizens deserve the affordable, accessible cancer care they have been promised and they are paying for.
Stakeholders were speaking in Nairobi during an engagement forum that brought together cancer patients, healthcare providers, cancer survivors, the National Taxpayers Association, and civil society organizations, where they called on the government to urgently address the SHA system failures and stock all essential cancer and palliative care drugs in SHA-accredited facilities. Elizabeth Atino, TV 47, Nairobi.